Good morning, good afternoon, good evening. Depends on when you're watching the video. I'm still your resource person, Don Wokike. I still want to emphasize on the psychology of drug abuse and addiction. Yes, I want to talk about thoughts as a major cause of drug addiction. Thought as a major cause of drug abuse. Yes, there's no way we can talk about psychology without bringing in what is called thought. Thought is a past tense, as you know, or past participle of think or think on, which is a continued term for thought and for think. For you to think a particular thing, that means if that particular thing is not being carried out, the anxiety or the restlessness persists. Okay, now let's come to drug abuse and how thought is a major factor of drug abuse. Why I'm bringing this particular topic as a thought major cause of drug abuse is to say whatever the mind, according to what Bible said, thinketh is what the mouth speaketh, and that is how an individual acts. Thought is also an emotional process. Yes, it's a cognitive state of mind where an individual take into mental possession of a particular event. It may be passive event, it may also be an event that is visible. Now, we're talking about drug abuse and addiction has been influenced by thoughts. Sometimes most individuals can relax, and when they, because they have that obsession, another name for thought is called obsession, which is thinking process, which is thought process, or what is being remorbid in your heart. That particular thought process or thought of taking a particular drugs of abuse, let me say drug that you are even addicted to. For it, very soon we'll talk about substances or drugs that are easily abused. But let me just talk about how thought play a major role in drug abuse. One, there is something that we call perception. Perception is seeing or reflecting a particular thing from the five sensory organs. So they say one, the basic thing that bring something or bring a particular event into thinking or into thought process is visibility, that is seeing that particular thing with your eye. Let me say, the other thing again is hearing. An individual can hear of a particular talk. For instance, when they are talking about drug abuse, the drug you have been abused or addicted into, and you see that you now carry that particular drug or event you had and put into thinking schema. They want to call schema. Schema is just like the thinking processes that take place in the heart and in the mind. Then what again is perception, that perceiving, that is smelling, having the feeling through the nose or smelling something via the nostrils. And you can some persons that are undergoing drug rehabilitation, once they pass where they are smoking, for instance marijuana, you see them that they will now go into thinking schema. They will first of all process that particular smell, and in a deeper aspect of neuro psychology or neuropsychiatry, they want to call rhinecephalon in the limbic system. That play this particular area in the limbic system play the role of trying to put into thinking process of what you have perceived. Rhyme, when you talk about rhinecephalon, you're talking about the organ related with the nose and the perception of a particular smell. Then I don't want to go much again, considering all the senses. I want to talk about the tongue, the importance of the tongue in trying to bring into addiction. Yes, some persons can just, experimental phase of any drug addiction is when you test the drugs. You have not seen the drugs, but for instance, if the drug is being tested with your tongue, if it is sweet or it is accepted by your body. See the individual becoming addicted or started abusing the drug. Like that, how some persons that started from sending message from a father, they go into experimental phase. From experimental phase, they go into occasional, rather occasional. They go into habitual. From habitual, they go into addiction, and all these processes come through thinking. So let me tell you one thing. The one thing that is very, very important in life: thinking. Thinking takes place in the mind, and this is what is happening emotionally, in fact, subconsciously or consciously, but sometimes it can also be repressed. If being repressed is another problem, which will also be discussed later, we are trying to tell you about how thoughts can lead to drug abuse. Whatever you think of is what you do. If you think that you are free from a particular thing, you are free. Your thoughts, according to Napoleon Hill, in his book Think and Grow Rich, he made mention of thoughts as a basic concept for an individual to grow rich. Thought can also be a concept for an individual to even go down, that is, become a poor person. Because we have two types of thought. We have positive thought and negative thought. And positive thought is talking about thinking for growth, thinking for productivity, thinking for promotion, thinking for whatever thing that will come into you. There's a book that said that thinking is the secret. This book, when I was going through this book, I realized that when you think something, that thing you think will not be possessed by you, because by your conscious mind, because